Hey everyone, welcome back to Vetology, Veterinary Science Simplified. I am Sivasubramanian and today we are stepping into the operating theatre. We are covering the tenets of Halsted, the foundational principles of surgical technique that every veterinary surgeon is expected to follow. So, who was Halsted? William Stewart Halsted was an American surgeon of the late 19th and early 20th century, widely regarded as one of the founding fathers of modern surgery and the first chief surgeon of the Johns Hopkins Hospital in Baltimore. He pioneered concepts like meticulous tissue handling, careful hemostasis, and anatomical dissection at a time when surgery was fast, brutal, and infections were rampant. Hospitals back then were literally called houses of death. Patients avoided them if they could. Halsted changed all of that. His approach was simple: careful, precise, gentle surgery leads to better outcomes. And he was absolutely right. But the most fascinating thing Halsted ever did wasn't a surgical technique. It was something he did for a nurse named Caroline Hampton. And that brings us to the love story. Now, if you are here strictly for the tenets and want to get straight to the point, skip ahead. But if you have 2 minutes to spare, trust me, this story is worth it. It's 1889. John Hopkins Hospital is brand new. Halsted runs a strict operating theatre and he has a rule. Everyone who steps in must wash their hands with soap, then dip them in potassium permanganate, followed by a hot oxalic acid bath, and then wash again with a mercury chloride compound. An absolute chemical gauntlet, brutal on the skin but effective at killing germs. Working alongside Halsted was his chief surgical nurse, Caroline Hampton. Halsted himself described her as an unusually efficient woman, sharp, calm under pressure, exceptional manual dexterity. She was by all accounts extraordinary, and historians have noted that Halsted was very clearly, if quietly, in love with her. Then one day in the winter of 1889, Caroline walked into the Halsted's office and told him she was quitting. The chemicals had destroyed her hands. Severe rashes, eczema, skin peeling. She simply couldn't take the pain anymore. Now, here is where it gets beautiful. Halsted didn't find a replacement nurse. He went to the Goodyear Rubber Company in New York and personally requested, as an experiment, two pairs of thin rubber gloves with gauntlets, custom made for Caroline's hands. He wrote later, as she was an unusually efficient woman, I gave the matter my consideration. That might be the most understated love letter ever published in a medical journal. The gloves worked beautifully. Caroline's hands healed. She stayed, and when Halsted returned from a vacation, he found that most of his theatre staff had quietly had gloves made for themselves too, and were wearing them during operations. His colleague Joseph Bloodgood later showed that gloves dramatically reduced surgical infection rates. So every time you snap on a pair of surgical gloves before an operation, you are wearing the legacy of a love story. Not bad for a pair of rubber gloves. Now, with that context in mind, let's get into the tenets. These principles weren't written in a textbook first. They were lived out in Halsted's operating theatre, refined over years of surgical practice and validated by patients' outcomes. They remain the gold standard of surgical technique today because biology hasn't changed. Tissues still respond the same way to trauma, ischemia, and infection. Violate even one tenet and you compromise the entire surgical outcome. These aren't just exam points. They are what you will live by every time you step into an OT. Tenet 1: Gentle handling of tissues. Every time you grab a tissue roughly, crush it with forceps, or tear instead of cut, you are creating trauma. Traumatized tissue means devitalized cells, inflammatory response, delayed healing, and a higher risk of infection and necrosis. In practice, use tissue forceps gently. Avoid excessive retraction. Handle organs with moistened sponges rather than dry ones. And never squeeze tissue unnecessarily. Think of every structure you touch as something that has to heal perfectly after you close. The classic analogy: imagine picking up a piece of wet paper. Grab it roughly and it tears. Handle it gently and it holds. Your tissues are exactly that delicate under a scalpel. Tenet 2: Aseptic surgery. This one is non negotiable. Asepsis means the complete absence of pathogenic or microorganisms from the surgical field. Every breach of aseptic technique is an open invitation for surgical site infection. Aseptic technique covers everything: sterilization of instruments, draping of the patient, scrubbing and gowning, maintaining sterile zones, and the golden rule: if you are unsure whether something is contaminated, assume it is contaminated. Tenet 3: Anatomical dissection. There are two ways to dissect: sharp dissection using a scalpel or scissors along the natural tissue planes, and blunt dissection using fingers or blunt instruments. Halsted advocated for sharp, precise dissection along the anatomical planes. Why? Because nature has already given you the roadmap. Tissue planes exist for a reason. A skilled surgeon follows those planes, separating structures cleanly rather than tearing through them. If to cut the muscles, it is better at tendinous portion than belly. Main nerve trunks should be shifted to one side than cutting it. The result is less bleeding, less trauma, and faster healing. This is also why your anatomy classes in the first year matter far more than you think. You cannot dissect anatomically if you don't know the anatomy. Tenet 4: Control of hemorrhage. Uncontrolled bleeding during surgery is dangerous for obvious reasons: hypovolemia, shock, death. Bleeding should be controlled at every stage during dissection because to reduce loss of blood and to reduce soaking of the site affecting the efficiency of dissection. But even minor uncontrolled bleeding that doesn't threaten life compromises healing. Blood pooling in a wound is a perfect culture medium for bacteria, prevents tissue layers from opposing correctly, and contributes to dead space formation. Hemostasis can be achieved through ligation, electrocautery, hemostatic clamps, bone baths, or topical hemostatic agents, depending on the vessel and situation. Tenet 5: Obliteration of dead space. This one is underappreciated. Dead space refers to any potential cavity or gap left between tissue layers after closure. When you close a wound leaving a void underneath, that space fills with serum, blood, and lymph. That fluid collection, called a seroma or hematoma, is a breeding ground for bacteria and a mechanical barrier to healing. Dead space is eliminated by layered closure, closing each anatomical layer individually, bringing tissue back together as it naturally was. Always ask yourself before you close: is there a gap here? If yes, address it. Tenet 6: Use of a minimum quantity of suture material. Suture material is a foreign body. Every suture you place triggers a foreign body inflammatory response in the tissue. The more suture material you leave behind, the greater the inflammatory burden on the wound, leading to delayed healing, increased infection risk, and excessive scarring. The principle is simple: use just enough suture to achieve your closure, no more. Place sutures at appropriate intervals. Use the correct suture size for the tissue, and avoid burying excessive knots and loops in the wound. A wound closed with precise, minimal suturing heals better than one stuffed with unnecessary material. Tenet 7: Avoidance of suture tension. When you close a wound under tension, meaning tissue edges are being pulled together forcefully, several bad things happen simultaneously. The sutures cut through tissue. Circulation to the wound edges is compromised, and the wound is far more likely to dehisce, break open postoperatively. Tension-free closure means the tissues comes together naturally without being forced. When primary closure isn't possible without tension, the surgeon uses techniques like undermining, releasing skin from underlying tissue to give it more mobility, or reconstructive options like flaps and grafts. A simple clinical rule to remember: if you are pulling hard to bring the edges together, you need a different approach. Forcing closure under tension is one of the most common causes of wound breakdown in veterinary surgery. Don't do it. Tenet 8: Immobilization. The final principle, and the one that extends beyond the operating table. A healing wound needs rest. Movement at a surgical site causes mechanical disruption of the healing tissue, breaks down fragile new granulation tissue, pulls on sutures, and significantly delays healing. This is why postoperative immobilization is not optional, it is a surgical principle. In veterinary practice, this means splints, bandages, casts, slings, or cage rest, depending on the location and nature of the surgery. An orthopedic repair that is technically perfect in the OT can completely fail if the animal is allowed to run around at the home the next day. Immobilization also applies intraoperatively. Proper patient positioning and fixation ensures the surgeon can work precisely without the patient shifting, which directly supports all the other tenets we have discussed. Content in this video is based on my veterinary surgery class notes and Slatter's textbook of small animal surgery. The historical story of Halsted and Caroline Hampton is documented across multiple peer-reviewed sources, including the PMC article Caroline Hampstead Halsted, the first to use rubber gloves in the operating room, and the Science History Institute. And that's the wrap on Tenets of Halsted. 8 principles, one love story, and a legacy that every surgeon carries into the OT with them every single day. If this video helped you, hit like, drop your questions and suggestions in the comments, and subscribe to Vetology for more. See you in the next one. Bye.